Facebook as well. So that is in process. Okay, good afternoon, everyone. This is Dr. Richa. I'm a physiotherapist, and today, just a second. Today we are going to be talking about avascular necrosis. Yeah, so I'll be introducing our guest today, who's going to be answering all the questions that I have. So, Dr. Hari Krishna Mata, he's an orthopedic surgeon. He's MS in orthopedics from JIPMER and FIAA from Mumbai. And he's associated with Shri Balaji Hospital from Hubli, Karnataka. He's based out of Hubli and has about 11 to 12 years of experience in orthopedics. He's an expert in ACL reconstruction, arthroscopy, knee replacement, joint preservation, and more. His qualifications are he has done his MBBS from Dr. NTR University of Health Sciences in Andhra Pradesh, his MS in orthopedics from JIPMER, and has a fellowship in arthroscopy and joint replacement of knee and shoulder from Bhatia Hospital in Mumbai. So he practices at Shri Balaji Institute of Neurosciences and Trauma in Hubli, Vidyanagar, and he is the first certified regenerative orthopedic surgeon in North Karnataka and has conducted the first knee joint cartilage transplantation in North Karnataka. So was I right about that? I cannot see you, sir. So your audio is muted.
Yeah.
Okay. So, sir, I did your introduction. I hope I was right.
Yeah, perfect.
Okay. So we'll begin about avascular necrosis.
Yeah.
Okay. So my first question will be, what is avascular necrosis? And I want it to be explained in the most layman terms, like a normal person could understand, because this is getting this is becoming a common disease these days. So, yeah.
Yeah. Good afternoon, everyone. And the topic is very relevant for the hip joint, especially. If you see the hip joint, this is an hip joint, and this is a femoral head, and this is the neck, and this is the trochanter. So what happens is usually the avascular necrosis of the femoral head, especially I want to talk in this session about the hip joint, where we see lots of patients coming with groin pain, getting groin pain since 2-3 months of duration, difficulty in squatting and sitting cross-legged. So they get pain in the groin region. So what is avascular necrosis of the means? The blood supply to the femoral head is, there is a superior retinacular vessel. So there will be a blockage of the vessel which goes to the head. It's like a heart attack. So if it's an heart attack to the femoral head, means the blood supply to the femoral head has been blocked. The causes are so many causes, means the most common cause is now is COVID, because in COVID, because of hypercoagulable state, there is a clot in the superior retinacular artery, which is going to disturb the blood supply to the femoral head. So it stops the blood supply to the femoral head, and then the head starts damaging like a heart attack. And what is heart attack means? Like in a heart attack, the heart muscle get damaged because of the loss of blood supply. Same like that. In this also, if the vessel is the blood supply to the femoral head is lost, so the head starts collapsing. Means it is called avascular necrosis of the femoral head. Means the blood supplying to the femoral head is lost. Same like a layman term, like a heart attack. आपका heart attack में blood supply to the heart will stop. So same like that, femoral head का blood supply बंद हो जाता है, तो ये head will start destroying itself. So that is
Right.
called avascular necrosis.
Okay. Yeah. So that was great. So the next question comes from first question itself. So like we have heard about the term avascular necrosis, which is a commoner term. What is osteonecrosis? And is there a difference between these two terms, osteonecrosis and avascular necrosis? Is there a difference?
No, actually, some coin term as osteonecrosis and some coin term as avascular necrosis. But actually, the best term is the osteonecrosis of the hip joint. Means there is a necrosis of the femoral head. So the best term to coin this is the osteonecrosis of the femoral head. But because it's since so many years, lots of literature has told that it is avascular necrosis, avascular necrosis. It is not the avascular necrosis, it is the osteonecrosis of the femoral head. So that the necrotic part starts of the superior area and start collapsing of the femoral head. So it is an osteonecrosis of the femoral head if you want to have the perfect term to coin this pathology. So it is an osteonecrosis of the femoral head.
Yeah, because it is affecting the bone, and
Yes.
osteo is bone.
Yes.
Yeah. Okay. So the third question is, are there any specific risk factors or a certain kind of population that is likely to develop AVN?
Yeah. Since 2 years post-COVID, there is a lots of patients coming to the hospitals with groin pain.
Yeah.
There is drastic increase in the femoral head problems after COVID. So
Yeah.
the most common cause is COVID now. So
Yeah.
if a patient comes to my OPD,
Yeah.
2 weeks back, a patient has joined to my OPD. He's a 45-year-old male, telling that, sir, since 2 weeks I am having some pain in the groin and some vague pain in the back. So the patient comes to me. I ask only first one question now. After 2 years of my experience of post-COVID, I'll ask him whether he has COVID or not. If he has COVID, means I will tell that, okay, you need an MRI scan for the hip joint. You will have AVN. That's it. Means the first commonest cause is COVID, and the second commonest cause is steroid induced. There are so many people who require steroid treatment. In the COVID also, there is a lots of people have taken treatment with steroid, and some rheumatoid arthritis patients can be supplemented with steroids. Lots of skin disease patients will be supplemented with steroids. So the steroid is the main second cause after the COVID for the femoral head blood loss, which causes osteonecrosis of the femoral head. And the third subsequent cause, which we tell most common, is alcohol. Sometimes, especially in the males who takes lots of alcohol, there is chances of getting avascular necrosis. And the fourth more common cause, means if you remove all these things, there is called idiopathic variety, where you see the idiopathic variant is the very commonest that we don't know the cause. That's so if we know the cause, the result will be better. That's what my feeling is. If you know the cause of the disease, means it is because of steroid, so that I can stop post-operative steroid. If I know that because of the COVID, okay, I know the COVID, post-COVID, the results are very good with Osgrow. So when a patient comes to me, if I feel that the first common cause is COVID, second is steroid abuse, third one is alcohol, and fourth one is idiopathic variety, where we don't know the cause.
Okay. So the cause will affect the course of the treatment and the disease.
Perfect.
Yeah. Okay. So the fourth question is, what are the investigative methods that can confirm an AVN diagnosis?
Yeah. So this is very important point I want to insist for the every people, that a patient presents to the OPD usually at stage 2 or stage 3. So that's what we miss the patient if it's stage 1 or stage 2, because the symptoms of groin pain usually starts from stage 1 to stage 2. So
Right.
if a patient comes to us in the OPD, I'll advise him pelvis with both hips, with lateral view of the both hips. But usually in stage 1 and stage 2, the femoral head looks okay, means it looks normal. So I want to get an MRI scan done for my patient so that I can see whether it is stage 1, stage 2, or stage 3 or stage 4. Usually in a plain X-ray, you can see usually there are 4 stages of AVN. So in the stage 3, stage 4, there is already a femoral head collapse, and stage 4 is arthritis. So in X-ray also we can diagnose them. So I require 2 investigation when a patient present to him in my OPD. The first one is X-ray with plain X-ray with both hip joints with lateral view of the hip joint, and second is compulsory MRI to see what stage it is. So it is stage 1, stage 2, stage 3, stage 4. And these are the 2 main investigation which is required to diagnose avascular necrosis or osteonecrosis of the femoral head.
Okay. So X-ray and MRI are 2 investigative methods one patient would require. Okay.
Yes.
So next question. Which parts or joints of the body can be affected by the disease? And what are the most common sites?
Yeah. See, avascular necrosis can happen to any end artery bones. Like femoral head is one of the commonest commonest region in the in the groin. In the foot, you can see the navicular bone gets avascular necrosis. In the hand, also we call as skin box disease for the lunate bone, where we see there is avascular necrosis of the wrist joint. And these are the 3 commonest areas. The talus bone also can go into avascular necrosis in the ankle. So the foot ankle region is most common, and there is an osteonecrosis of the knee joint also. There is called as SPONK, spontaneous osteonecrosis of the knee, where there is a acute knee pain can develop in the knee joint also. But the most common problem, which gives more troublesome to the patient, is the hip joint. So the hip joint avascular necrosis to be diagnosed early, and the treatment to be given very early so that we can prevent hip replacement. So the most common site in the body is the hip joint, the first commonest and the most commonest.
Okay. Hip is the commonest site where a patient would get AVN most likely.
Yes.
Okay. So the next question is the stages classification and its importance in AVN. So like you said earlier that it has stages, stage 1, 2, 3, 4. So there are classifications in stages also. And what is the importance of stages?
It's very important. That main treatment depends on staging of the disease. So the main staging of the disease depends on the classification only, because the stage 1, stage 2 has a different treatment, stage 3 is a borderline, and stage 4 has a different treatment. So if there's according to the FIAA classification, we usually but I want to talk to the layman people and normal view doesn't know anything about hip joint. So if it is only 4 grades or 4 classifications of the femoral head AVN is there. The stage 1, stage 2 is preventable, and if you comes early to us, the femoral head is not collapsed till now. So stage 1, stage 2, still the femoral head, the topi means the head is not collapsed down. So in the stage 3, means 2A, 2B or 3, the head starts collapsing, and there is a joint with the acetabulum here. So the acetabulum and the femoral head rotating joint starts destroying in stage 4. So the stage 1, it is only a minute changes will be there in the femoral head, and stage 2 there is almost 50% of the femoral head is osteonecrosed, and more than 75 to 80% of the femoral head is osteonecrosed in stage 3, and almost 100% is gone in stage 4. So stage 1, stage 2, still femoral head is not collapsed. So the treatment has lots of variation from stage 1, stage 2, and stage 3 and stage 4. So the MRI tells us which stage the patient avascular necrosis of femoral head is there. If it's stage 1, stage 2, the treatment is different. Stage 3, the treatment is different, and stage 4, the treatment is different.
Right.
So if you tell me that femoral head collapsed, it is stage 3 and stage 4. No femoral head collapse, stage 1, stage 2.
Okay, so stage 1 and 2 are like the early stages, while stage 3 and 4 are like intermediate and advanced.
Advanced stage.
Yeah. Okay. So the next question would be, how can AVN be treated, and can AVN be treated without surgery? Because this is like one of the most common questions you could find, that can it be treated without surgery?
See, there is lots of literature that it can be treated without surgery also. But the latest publications and the latest treatment protocols have been lots have been changed. Uh, 5 to 10 years back, a patient presents to me with a femoral head AVN. Is a 20-year-old male. I don't want to do hip replacement. So what options I have? So in them, I advise them for a core decompression. Previously, I used to do 10 cases of core decompression. 9 out of 10 used to be failed because the pathology is different and the treatment what we are going to give for the femoral abdominal osteonecrosis is not adequate at the time. So as the time changes on and once the regrow biosenses come up, and once the stem cell that bone implantation has come up, the total treatment has changed. So previously I used to do only core decompression. Now I'm adding the bone cell therapy to the femoral head so that it doesn't collapse. So if I want to tell that without surgery it's not possible, because it is going to become stage 4 if you eventually. There are different treatment lines which are telling bisphosphonates are there. Some people give aspirin, some people give blood thinners, but still these are all debatable. There is no permanent solution for the AVN. Surgery is the only modality to treat these cases. There can be a case. See, it's not like that in 100 cases one can be treated without surgery
Yeah.
also, but it's very
Yeah.
rare. But in my
There.
experience, I would have seen some thousands of avascular necrosis of cases. In these cases, uh, medically it's not possible to treat these patients. They require surgery. Some or some other modality, means like only a core decompression. See, if I tell only core decompression is first option, core decompression with bone cell therapy is one option, core decompression fibula, there are lots of options are there, totally replacement. So
Yeah.
without surgery the chances of getting normal is not possible.
Yeah. Right. Okay. So one cannot say that, without surgery he can be treated. Eventually they have to wait for hip collapse and replacement that way, because the literature suggests so. Right. Okay. So now that we have covered how can it be treated, let's also talk about what is orthobiologics and bone cell therapy, that is regrowth.
See, what is the orthobiologics means this, there is something to aid to prevent the collapse. Uh, there is need some cell which gives a remodeling of that area, and it starts growing and filling that area. See, if you see the knee joint, there is a cartilage loss. We used to put in orthobiologic solutions like hyaluronic acid. Hyaluronic acid is also one of the solution which give into the knee joint. It gives like a layer forming in the knee joint. Some option of bone marrow aspiration cytology, where we take the bone marrow cell and inject into the femoral in the femoral head, into the knee joint also. It is also one type of this. These are all what is orthobiologics means. These are the cells which aids in healing of the bone or into the joint. So if you inject into the joint is going to become a normal, or into the femoral head, it is going to become a normal. So the bone cell therapy, which is OSGROW, it injects almost 50 million or 100 million cells of osteoblast, pure osteoblast. See, now a patient comes to me telling, sir, one doctor has advised me bone marrow aspiration cytology, and you are
Yeah.
advising OSGROW, which is a bone cell therapy. See,
Yeah.
if according to me, the bone marrow aspiration cytology, we don't know how many osteoblasts are there in that. There we cannot quantify. See, as an orthopedic surgeon, I require lots of osteoblasts to prevent the collapse so that my head will be remain without collapse. So the bone cell therapy, which we give in avascular necrosis, it contains 50 million cells or 100 million cells of osteoblasts. They are pure osteoblasts. See, if you see a bone marrow aspiration cytology, it has a mesenchymal cell. The mesenchymal cell can differentiate into different cells.
Right.
But in bone cell therapy, we are giving targeted cell, means which requires for the femoral head only to grow the bone so that it will not collapse. See,
Yeah.
I get a
Specific.
patient, if I get a patient asking, sir, it is a blood supply block, how it is going to improve?
Yeah.
You are giving only a bone cell therapy. So I tell them, I used to do the same 5 to 10 years back, just drilling the femoral head and come out. In that, in 10 patients, 1 patient is getting normal. Because once I drill the femoral head area, once I drill this area with a drill, I am able to create some space here so that the intra-osseous pressure is decreased. And once I decrease this, then there is a neovascularization happens here. And once I inject my osteoblast in this region, there is formation of the femoral head. It's like a collapsing of the roof is prevented. Means if in a home, in a house, if the roof is collapsing, we go and keep some support like a pillar. So same like that, the osteoblast in the femoral anterior superior area, it starts supporting the femoral head area. So it's totally it's like a pillar. So it starts growing immediately the superior area, so that this bone cell implantation in the femoral head area prevents the subsequent collapse and prevents the stage 2, stage 4. Then I get a patient. Why it doesn't work in stage 3, stage 4?
Yeah.
In stage 4 especially, because this is a joint. So if I inject bone cell therapy in the femoral head, there is already cut-dye there, means there is already hole here. So if I inject the bone cell therapy, it is going to come into the joint. It will not stay into the femoral head only. If I in a stage 1, stage 2, and stage 3 also, there is still the head is not collapsed. So the bone cell therapy will stay there and holds there, so that it starts growing from that area. So that's why orthobiologics, that's especially the bone cell implantation, going to help in this avascular necrosis of hip joint.
Okay. So bone cell therapy basically is a specific treatment for bone related issue, since AVN is a bone related issue and osteoblasts are responsible for bone growth. So it is a very specific treatment, unlike BMAC or other treatment
That's right.
options where
BMAC has mesenchymal cells, but I want an osteoblast because mesenchymal cell can differentiate into osteoblast, or there are so many variants of cells. But the targeted therapy which aids, which gives only osteoblast, which I as an orthopedic surgeon, I require an osteoblast.
Right. Yeah. Okay. Now that we have covered that, let us talk about total hip replacement, which is like the ultimate end of AVN. If a patient has a collapsed hip, then the treatment option that is with them, it is total hip replacement. So what are its pros and cons?
Yeah.
While someone who is considering it.
Natural is natural. Preserving the natural means as a joint preservation surgeon, because I preserve lots of joints, knee joint, shoulder joint, hip joint, and all. As a joint preservation, natural is natural because we preserve lots of things. The biomechanics of the natural joint is different, and the biomechanics of the artificial joint is different. See, if a 20-year-old male person or a young laborer which comes to me and asks me that, doctor, somebody advised me hip replacement, and he wants to sit down, squat down, and do heavy work, it's not possible because it's an artificial joint. It has some lifespan, like 10 to 15 years. And if he sits down, squats down, and do lots of work, there is a poly layer which is in the hip replacement which wounds out very faster. So the pros of hip replacement in young patient, it should be avoided because of the lifespan. It's not like a natural joint. It's like an artificial joint has some lifespan. Means there is some 10 to 15 years of joint can be there. Again, it will require a revision surgery. So if you tell, if the pros means no, there is only cons only for the young patients, especially because the young patient is stage 3, stage 4 undergoing replacement. It's definitely means it's a overkilling. Means if the patient has stage 1 and stage 2, if you do hip replacement, so what other doctors advise is, अरे भाई stage 3, stage 4 तक आने दो, then हम replacement करेंगे. Means they want to avoid the hip replacement in young patients also, because they also know, all orthopedic surgeons knows that the lifespan of the implant is very small, shorter duration. So and the very common problem is infection. The infection of the total hip replacement is very disaster. And now because of good operation theaters, we're getting it down. Still, infection is one of the most common problem in total hip replacement. And it doesn't give a normal biomechanics to the hip joint, and they require revision. And the cost of the implant also, the cost of the implant, it starts from 60,000-70,000, it goes up to 1.5 to 1.8 lakhs. The latest one is ceramic, and it adds burden to the patient also. Means it's usually costs around 3.5 to 4 lakhs in the bigger city setup if you want to do a good total hip replacement. But if you want to do an osteo, means a bone cell implant, it will not cost much as compared to the total hip replacement. So according to me, the natural is the best, and the artificial we should keep for the stage 4 only. Stage 3 still we should try to preserve the hip joint.
Yeah.
But only replacement has lots of disadvantages compared to the natural joint.
Right. So the goal is ultimately preservation, because natural is natural, and hip replacement is like the last treatment option, like when there's nothing else left. So yeah. Okay. So now the last question, like what should a patient do if he or she is diagnosed with AVN?
The first thing is they should search for which is the best option for the AVN. So the best option for the AVN now, since some 4-5 years and since 2 years in our region where I work in North Karnataka, and previously people used to do hip replacements, we have changed totally different now, and I can tell proudly that I have saved 30 hip joints now, and who are very young people. And yes, deforestry also I've done one case. She's a 34-year-old lady with bilateral one side I've already done. She was happy and came for other side. So if the patient wants to preserve the hip joint, definitely osgood is an option. Definitely, see, we are here to preserve the joint. See, and in the science there is no 100%. They should also know that in science there is no 100%. They cannot ask for 100%, but we are here to help them, and we want to save their hip joint. But still, the hip replacement option is there. But according to me, if the patient has stage 1, stage 2, and stage 3 borderline 2B, which doesn't have a head collapse, definitely Osgro is an option, and they should go for an Osgro, or means some people have results with BMAC also. I'm not telling it. I have seen the patient with BMAC also. See, in the BMAC, there's again lots of literature doesn't support the BMAC, because BMAC has again failure rates because of the mesenchymal cells. And in the Osgro, where we use osteoblast, and the osteoblast treatment has very well advanced treatment. And I have my own self experience, and Dr. Gaurav Palikar sir already has done lots of cases. There are already published articles on that. So if a patient comes to a doctor, they should ask for an option of preserving the joint.
Right. Yeah.
What I want to tell, if they want to preserve the joint, next, if it is not possible, then definitely hip replacement. I have a case series of 5 patients, which one side they undergone Osgro, one side is totally palsy, because it is on stage 4 on one side and stage 2 on one side. So if a patient has stage 2 and stage 4, definitely I told, because the joint should not have it, the head should not be, that means the roof should not be collapsed. That is the main aim for the bone cell implantation, that the roof should be proper so that it doesn't go into the joint, it stays in the femoral head and preserve the hip joint.
Yeah. So even I feel like any patient would obviously want to preserve their hip
joint.
Yeah, anyone, especially the young patients nowadays, like after COVID.
Post-COVID, I've seen lots of people who with young people, means 20, 25, 30. Even lots of physicians, means recently who works for the patients for the COVID also. They got treated from me, and 3-4 couple of physicians who because of COVID, who treated the patients of COVID patients, and now they're happy with Osgro, and it takes some time. See, it's not a quick result, and I want to tell everybody is that after the surgery, MRI is not indicated, because it takes some time to get the result. And so every patient has that, I want to get an MRI to see what stage it is. See, for conversion of stage 2 to stage 3, it takes lots of time. And it's not like that surgery kar diya, time like it takes some time to heal the joint, and patient subsequently in 6 months, 9 months, they become better. And if they want to undergo, we'll see. I'll advise only X-ray. Post-operative, till 1 year, I'll not advise MRI for any of my patients.
Right.
So I'll advise only X-ray. If there is no collapse, means I'm happy. Means I can see the collapse in the femoral head. If there is no collapse, means I can happy that still it is remodeling.
Yeah.
So the post-operative MRI should not be advised, because it's difficult to read post bone cell therapy MRI, because it is a recent advanced treatment.
Okay.
So any patient who comes to the hospital or OPD, they want to preserve the hip joint. If it is not able to preserve like stage 4, definitely total hip replacement is an option. But younger patient, we should avoid total hip replacement as little bit of duration, so that little bit they become older, we can do hip replacement.
Yeah. So these factors are taken into consideration when deciding a treatment. So all the patients must do their due research, and out of the available options, what is best for them. And like you said, that being an orthopedic surgeon, and since you have treated so many cases, you have seen the results as well. So if there is a chance to preserve hip, you would want that they go for something like bone cell therapy if they are an ideal patient. That is decided by obviously the hip
Surgeon who sees the
preservation
patient.
surgeon. Yeah, they are the ones who see that is this patient an ideal candidate, and if the treatment is gonna help them or not. So that was very informative, and I hope that this reaches out to the people who need this, because there have been lately many cases and the people want to know more and more. So hopefully they will find this useful and could be helpful to them in some way. Okay. So I want to thank you, sir, because you have taken out your precious time uh, for this session, and it was very good talking to you. Do you have any message for everyone who's watching?
Preserve the hip joint. That is what I want to tell. Natural is natural. So preserve the joint as much as possible. Take second opinion also, but total replacement is an advanced surgery, means which is required only for the stage 4. So until stage 1, stage 2, stage 3 borderline cases, still we should go for a hip preservation surgery, because natural is natural.
Yeah. So patients, like if you're an AVN patient, you still have hope. Just be vigilant, and time is of essence. So yeah, that is to sum it up. So thank you, sir. Have a nice day. I think we should end this now. Okay.
Thank you.
Bye.
Thanks, Regrow Biosenses.
This is Richa.
Thank you.